Hey everyone, today I'm going to be showing you how to take blood sugar like at a blood sugar outreach event. Now today I'm going to be demonstrating on myself, but at these outreach events we'd be taking a patient's blood sugar, but all the materials you see here are going to be similar to what we'll have for you to use at events. So first I've got a bottle of hand sanitizer. You can also wash your hands. I've got an alcohol swab, a cotton ball, a band-aid, a single-use lancet device. We use single-use devices just because we're interacting with a bunch of different patients and we don't want to be using like a lancing machine. Typically, diabetics will have their own lancing machine, they just keep loading lancets in it, but because we'll be interacting with a bunch of patients, it's better to just use a single-use device for each patient. And I've also got some test strips and the appropriate meter they go with. And then I've got a homemade sharps container. Laundry detergent bottles are pretty common because it's good to have a container that's made of hard plastic and also has a screw on top. And then what I'm going to do to get started is I'm going to go ahead and clean my hands. And then I'm going to go ahead and take a strip and load it into the device. And just some helpful things to note. This strip is it's nice enough to have an arrow that points to the end that you insert into the machine. Sometimes they don't have that, but typically if you look for the side that looks like a computer chip, that's the side that goes into the device. And then when you insert that into the device, that's usually enough to turn it on. And a lot of devices, once they're ready to be used, they'll have this blinking blood drop. And typically that just means that it's ready to go. So I'll put that aside. And I'm going to go ahead and use my alcohol swab and pick a finger. I'm going to use my pointer finger, and it's going to be important to just wipe down the tip. And then when I'm picking a spot to draw blood on a patient, it's usually a good idea to use an edge of the finger, so like using the side instead of the middle. Usually it's less uncomfortable when you use the side of a finger. And also, I'm just making sure that the alcohol dries before I go ahead and stick someone. And then to open these lancets, typically this is the same for a lot of different single-use lancets. You're going to want to twist the top, and that should release the little safety. And then what I'm going to do is pretty much go to that side of the finger and then push down. And then you'll see I've got a little drop of blood, and I'm immediately going to put this used lancing device in my sharps container and rescrew the lid. And then what we like to do is wipe away the first drop of blood with the cotton ball. And then I'm going to try to draw my second drop of blood. And then you're going to want it to be kind of bigger than a pinprick because you want to have enough for the machine to suck up. And then what you're going to do is you're pretty much going to hover the end of the strip over the drop of blood. And it should look like it sucks up the machine. And then it's going to go ahead and read. Alrighty, and then I've got my reading, and it's as fast as that. And when you're sucking up the drop of blood, you're going to want to make sure you see it go up the strip like capillary action. Otherwise, the machine's not going to get enough blood to actually read. And then after this point, I usually ask the patient if they want a Band-Aid or if they just want a cotton swab. Usually if it's an established diabetic and they're sticking themselves all the time, they'll usually just make do with a cotton swab, but typically just cater to whatever the patient wants. And then everything else can go in the trash. Typically we'll have biohazard bags available for anything covered in blood. But since I'm at home right now, I'm going to be just throwing them in the trash. And that's it. Feel free to reach out with any questions to either the Operation Diabetes team at CAPS or the diabetes team at SNAVA. Thank you.